All right, I brought the expert on recovery with me today. All right, I've got Dr. Landon Pryor here, and I'm always talking about vitamin B12, and I'm talking about how that works in the body and just the basic gist of how it increases red blood cells and helps you produce red blood cells. But I wanted to bring someone that truly is in the field all the time. You see, Dr. Pryor is a plastic surgeon, and he's been on a couple of episodes here on my show, but he wants to be able to be here to talk about the importance of B12 as pertains to recovery. So, Dr. Pryor, thanks for coming on again, man.
Thank you for having me. Yeah, it's great to always be here with you, Thomas, and nobody knows more about B12 than you do. But from a surgical standpoint, it's absolutely necessary to recover. And like we talked about in previous videos, with any kind of surgical insult, there's going to be a recovery, and that starts with inflammation. So like we mentioned, inflammation isn't always a bad thing. You need inflammation. That's going to bring the healing cells to the area of injury. And without appropriate nutrition, which includes B12 and potentially supplementation, you're not going to be able to heal from anything, but especially from surgery.
Gotcha. So B12, when we're talking about it, to give you the basic understanding of what B12 is B12 helps the formation and truly does support the formation. In fact, is critical to the formation of red blood cells. And red blood cells are what are going to be delivering oxygen. And we have a tendency, especially younger generations, a tendency to think, well, I don't really care about B12 because it's just a health thing. It's just, I don't really care about my health. I'm more concerned about my performance. But the fact is, why do cyclists blood dope? Why do cyclists sleep in altitude chambers? Why? Simply because they're trying to increase their red blood cell count. They're trying to increase that because it does help performance. It does help recovery. And you wanted to talk a little bit about how it works in relation to surgery and recovery from there.
Well, as you know, most of us are vitamin deficient, and especially B12 vitamin deficient. Thomas has a great little video on YouTube. You could learn a little bit more about it from there. But as it pertains to surgery, without vitamin B12, you're not going to be able to bring those healing red blood cells to the area of injury, and the recovery is going to be slower. You're not going to be able to heal as well. So it's critically important to maximize your B12 supplementation or diet prior to and after surgery so that you're able to heal as quickly and efficiently as possible.
It's a perfect segue into the other form of surgery that you're doing every single day in the gym.
Working out.
That is, in a sense, a form of surgery on your body. You're breaking down, causing this micro trauma. So I wanted to have Landon explain the science real briefly on how red blood cells work and how they help recovery. But let's take a look at it now as it pertains to working out. That same premise applies. You need the red blood cells to encourage the oxygen and the nutrient delivery so that you can recover. It's not just about energy, it's not just about that. It has to do with flat out being able to recover from your workout in general. And the red blood cells work simultaneously with what's called hemoglobin, and that hemoglobin is what carries the waste away from the cell. So helps carry the inflammation away, helps carry the carbon dioxide away so that your body can actually recover. Now, in your practice, you have a lot of people that want to do B12 injections and things like that. So are they generally coming to you because they want more energy? Is that?
So we see both in the practice. We actually recommend it as part of a surgical package for people that are going to have surgery or have some kind of treatment that requires inflammation and healing, because we want them to do it as safely and effectively as possible. So because of the popularity of B12, some people, whether or not they're having surgery, are just looking for it. They want to feel better, they want to be more energized, and for that there's ways to supplement it with shots in the office on a weekly basis to maintain your levels and continue to have those red blood cells so that you can maximize your performance in the gym and in your everyday lifestyle. And then we have patients that are having surgery or have some kind of procedure done in the office where we'll actually incorporate and recommend B12 among other types of vitamin supplementation to make sure that they're optimized prior to and during surgery and recovery.
Gotcha. And when someone is talking about B12 injection or B12 supplementation, I just want to make sure that you're taking something tangible away from this. When you have a B12 injection, you're bypassing sort of that initial pass through the liver. You still have a pass through the liver, but you're bypassing that initial sort of ingested pass through the liver. So it's significantly safer. And let me talk about the 3 ways that you can take vitamin B12 really quick. One is the injection we just mentioned. It's important. It can be cumbersome if you have to go to the doctor all the time, but it's extremely effective. Okay, the second one is the one that you see on the shelves a lot, and that's called cyanocobalamin. And I know it's a mouthful, but cyanocobalamin is traditional oral B12. Well, the thing is that cyano, that prefix, stands for cyanide. It has a cyanide molecule attached to it.
I didn't know that.
Yeah, so when you take regular...
I don't want that anymore.
No. So like an oral B12 supplement is generally not the way to go, but there are ones out there that contain methylcobalamin. You've seen me talk about like PuraTHRIVE before. You've seen me probably talk about them before. They have a methylated version, a methylcobalamin. Now with that methyl group attached to it, it's allowing the liver to do its job a little bit more efficiently, where the liver isn't having to break down the cyanide away from the cobalamin group. If you can imagine your body, what it has to go through to break down cyanide,
more energy,
it's more energy, more work,
yeah.
and you're kind of defeating the purpose. You know, you're trying to do something to get healthier, and you're putting cyanide in your body. Those are the pills that astronauts would take if it was a kill pill.
Yeah, right. They got stuck in space.
Yep, they just didn't want to like blow up. You know, you'd rather just die from cyanide. So I thought it was important to kind of give you that tangible information. So if you're looking for B12 supplementation, make sure you find one that's a methylcobalamin or get an injection. Stay away from the cyanocobalamin. So Landon and I are going to be doing a lot more videos, and I want to make sure that you guys comment and let us know what kind of videos you want to see. Landon, say a little bit more just about what you do so that they have an understanding for those of you that haven't watched some of the other videos.
So I'm a board-certified plastic surgeon. I have offices in Chicago and Beverly Hills, and I do the scope of plastic surgery, what you would typically think about. So facial rejuvenation, facial cosmetic surgery, body contouring, breast surgery. And really my focus is not only helping people feel better externally about themselves, which obviously is what a plastic surgeon is supposed to do, but I really want people to be able to lead a healthier lifestyle and not only feel better about themselves physically, but just feel better in general so that they can have a better quality of life. And that's why I'm here with Thomas and why I partnered with him for my own personal needs and now professionally. And it's just, you know, a great way to think about the paradigm differently rather than it's either about internal health or external appearance. It's really all the same thing, because at the end of the day, we just want to look better so that we can feel better. And essentially, Thomas is able to do that without a knife. I do it with a knife, but together we're better.
Awesome. As always, make sure you keep it locked in here on the channel and let us know what you want to see in the future. Thanks, Dr. Pryor.
Thank you.
Cool.